Welcome to my final presentation for Educating Exceptional Students. This has been a wonderful class, and I'm very happy I was able to be a part of it. My presentation today is on the social, cognitive, intellectual, and academic characteristics associated with different types of exceptionalities. The first exceptionality I'm going to talk about today was covered in Chapter 5 of our textbook, and they are learning disabilities. One of the biggest things actually about every exceptionality is that it will present differently in every single student. So learning disabilities have a very large range of severity level. Students with learning disabilities do experience more signs of depression. Students with learning disabilities have a higher anxiety level. But I think most importantly, most students with learning disabilities do not have mental health problems. And that is very important to remember, is even when you hear that students with learning disabilities have more signs of depression and anxiety levels, most students do not have mental health problems. The next exceptionality that I'm going to talk about was covered in Chapter 6, and those are communication disorders. Communication disorders include children who stutter, children who have problems with the development of R's, L's, TH sounds, and those students may have problems with social communication. And in those situations, teachers must learn to address the social needs of these students. One of the really important things to do is to use active listening to parrot back what the student is telling you. And as a teacher, that means you need to make sure to have one-on-one time with that student, to sit down, make eye contact, listen to what they're saying, and be patient enough to understand what that student is saying and to decode what that student is trying to tell you, and to also give them eye contact and social cues, and to help teach that student how to use social cues to understand what's going on. Of these chapters, the information was learned through the textbook and through additional information in the module, and then was assessed with the chapter quizzes. And then in Chapter 7, we covered emotional and behavioral disorders. The average IQ for students with an emotional disorder or behavior disorder is in the low average. There is a very high dropout rate. It's over 50%, which is much higher than average. It's just obviously something that needs to be addressed. There is a large number of students with emotional or behavior disorders who have been held back a year at school. In an elementary school level, it's within the 30% range. And then once you get into a secondary school, it goes up to even higher than that. There's also a very high cross between ADHD and emotional disorders and behavior disorders. I don't know the reasoning for that. I don't know if it's just the way of the brain structure, or if there's been any research into that yet. But that is a big overlap and something that teachers need to be aware of. But once again, emotional and behavior disorders are something that present differently in every single student. And if a teacher is working with someone with emotional or behavior disorder, probably almost certainly you're going to have a behavior plan. And I think this is when it becomes very important that you follow your behavior plan all the time. Because keeping that consistency with the student is going to be the best thing you can possibly do. Alright, the next exceptionality we are going to cover is ADHD. And once again, I know this sounds repetitive, but I think it is incredibly important that it is remembered, and especially in the classroom, that every child is not cookie cutter. ADHD presents differently in every single child. Children with ADHD are known to have lower academic achievement and lower vocabulary development. Once again, they have working memory problems, and that leads to lower reading comprehension. been a lot of new studies that talk about the structural differences in the brain with children with ADHD. And so as science learns more about brain development, hopefully we have different treatment options that will help students in the classroom. In the meantime, teachers in the classroom need to begin to make adaptations on their own, be more patient, work with the students, and remember that the objective is to help the student learn, is to help the student with reading comprehension, is to help the student with social interactions, with academic achievement, with their vocabulary development, and find ways to help that student, even if it is not what is being done for every other student. So the next exceptionality that is being covered is intellectual disabilities. And a student with an intellectual disability has completely different learning needs than other students. The curriculum for these students focuses on basic life skills. So you talk about money management, following a schedule, self-care, job skills, being somewhere on time, how to tell time, tying shoes, ironing clothes, doing laundry. So it can be done in school, and it can also be done in a real-life environment. A lot of programs will help you go to a laundromat, or will go to the grocery store, will do things in a real-life environment, an internship at a local job or a local place to volunteer, to help students transition into real life. And life skills or intellectual disability programs often also will have transitional programs for students 18 to 24. These programs start in basic elementary level with social skills, following directions, and then of course build up to the more difficult life skills of cooking and money management. Autism is going to be the next exceptionality, and I just realized I have not addressed how these were learned and assessed. My references are in the textbook and have all been assessed with the chapter quizzes. Autism incredibly varies with the child. There's a negative correlation between the severity and the IQ. So the more severe the autism, the lower the IQ. The less severe in autism, the higher the IQ. The average IQ of a person with autism is between 50 and 70, and 38% of people with autism have an IQ of 85 or higher. So approximately 40% of people with autism have an average IQ. And that, I think, is incredibly important to remember as educators. So when we hear the word autism, we shouldn't say person is going to need an incredible amount of help in my room, and they have an intellectual disability, and I can't teach them. Because not in most cases, but in 40% of cases, this person has an average IQ or an above average IQ, and will simply need some basic modifications to be able to succeed in the general education classroom. So the exceptionality that I'm going to cover is a traumatic brain injury. Traumatic brain injuries present with the same characteristics as learning disabilities, communication disorders, emotional behavior disorders, and intellectual disabilities. There are a couple of factors that really will tell you how traumatic or how devastating the brain injuries can be, and one of those factors is the age of the student when the trauma occurs. And the younger the age, the more severe the brain injury, the trauma is going to be. The low processing time is a common effect of a traumatic brain injury. So if you have a child, as an educator, if you have a child with a traumatic brain injury, if you ask them a question, give them longer to answer. So, what is 1 + 1? Don't expect that 2 to be an automatic answer. The child might know it's 2. Might know it's 2 all day long. but the recall is going to take longer for that student. And so that's something that you have to constantly keep in mind. And also with group work, the students that child works with are also going to have to know and be aware that the recall of information is going to take longer. Hearing loss is the next exceptionality that was covered in the book. And hearing loss can affect a student's spoken language, American Sign Language, icons, speech readers, and other technology. And technology right now is fabulous. You know, even our phones, if you pick up a phone, you can have text-to-speech on pretty much any website. So technology has a lot of different applications. So much easier, so much better. Hearing loss does not affect an IQ. It's very important to remember that just because someone has a hearing aid, just because someone uses ASL, just because someone has to use icons, does not mean that that person has a lower IQ. Proper placement in early services to ensure a student is able to have access to language is imperative to academic success. A child with hearing loss, especially a child who uses ASL or icons, that is that child's language, it's their speech. And to put them in a placement where they do not have complete access to that is to deny them of language. If you have a small child who uses ASL, and then they do not have an interpreter, they do not have a reliable interpreter in the classroom, you have effectively put them in a classroom with no language, and that's incredibly detrimental to that child. So as an educator, you have to make sure that a child is with hearing loss is just as immersed in language as every other child. And of course, with apps, and it is very easy to do. If you get on a phone, you can find an ASL app, translate almost anything for you, and 5 Little Monkeys can be translated in ASL, so it makes it very easy for educators. Visual impairments, and I have to hurry up here. Visual impairments, you can have additional educational needs and daily living skills, kitchen activities, laundry, clothing management, all things that have to be done and you have to learn to do. And I think one of the most important things is independence must be taught from a young age. One of the goals of special education is for all students to be independent, and students with visual impairments must be taught to be independent, to not be dependent on a para, to not be dependent on their teachers, but to learn to do things independently from a very young age. Yep. And then students who are gifted. Students who are gifted have a very high intellect. They are creative, have an academic aptitude, leadership skills, visual or performing artistry. They exclusive. So we read an article about it this week, and or there was an article about it this week in our module. So we cannot think that just because someone has a learning disability, they cannot also be gifted. So thank you very much for this class. It was a very educational class. I learned a lot, and I know that what I learned will follow me through my educational career. I hope you have a wonderful winter break.